Human circulatory system. Human circulatory system also called blood vascular system. Human circulatory system also called blood vascular system. Human circulatory system consists of muscular chambered heart and a network of closed branching blood vessels, then blood, the fluid which is circulated. Heart is derived from mesoderm. Heart is derived from mesoderm. Heart is situated in the thoracic cavity. Heart is situated in the thoracic cavity in between the two lungs, then slightly tilted to the left. Size of the heart can be compared with clenched fist. Size of the heart can be compared with clenched fist. Double-walled membranous bag which protects the heart is pericardium. Double-walled membrane which encloses the pericardial fluid. Double-walled membrane which encloses the pericardial fluids, that is pericardium. Number of chambers in the human heart, 4 chambers. Upper chambers of the heart are called atria. Lower chambers of the heart are called ventricle. Lower chambers of the heart are called ventricles. Upper chambers of the heart, atria. Lower chambers of the heart, ventricles. Our heart has 4 chambers, 2 relatively small upper chambers and 2 larger lower chambers. Chamber separated by a thin muscular wall. Chamber separated by a thin muscular wall. Interatrioventricular septum. Chamber separated by a thick-walled septum. Here small correction, atrial chamber separated by thin muscular wall called interatrial septum. Ventricular chamber separated by a thick-walled septum called interventricular septum. Interventricular septum. Chamber separated by a thick fibrous tissue, that atria and ventricles are separated by a thick fibrous tissue which is called atrioventricular septum. Atrioventricular septum. Thin muscular wall, whom we call thin muscular wall, interatrial septum. Thick-walled septum, interventricular septum. Thick fibrous tissue wall, atrioventricular septum. Septum which separates the two atria into right and left. Septum which separates the two atria into right and left. Interatrial septum. Septum which separates the ventricles into right and left. Interventricular septum. Septum between the atria and ventricles. Septum between the atria and ventricles. Atrioventricular septum. Each of these septa are provided with an opening. Through which the two chambers of the same side are connected. Each of these septa are provided with an opening through which the two chambers are same side are separated. Atrioventricular. Step side are connected. Atrioventricular septum. Opening between the right atrium and right ventricle. Right atrioventricular aperture. Opening between the left atrium and left ventricle is left atrioventricular aperture. Opening between the right atrium and right ventricle guarded by a valve formed of three muscular flaps or curves. We call the valve as tricuspid valve. The opening between the left atrium, left ventricle guarded by a valve formed of two muscular flaps or curves, and it is called bicuspid or mitral valve. Mitral valve is present between left atria and left ventricle. Opening of the right and left ventricles into the pulmonary artery and the left systemic aorta respectively are provided with semilunar valves. The valves in the heart allows the flow of blood only in one direction. Tricuspid valve allows the flow of blood from two. Tricuspid valve allows the flow of blood from two. Right atria to right ventricle. Bicuspid valve allows the flow of blood from left atria to left ventricle. Semilunar valves allow the flow of blood from two. Pulmonary artery, semilunar valves allows the blood from ventricles to pulmonary artery and left systemic aorta. Mitral valve allows the flow of blood from two. Mitral valve nothing but bicuspid valve. Left atria to left ventricle. Tricuspid valve prevents the backward flow of blood from two. Right ventricle to right atrium. Backward flow is going to be prevented. Bicuspid valve prevents the backward flow of blood from two. Left ventricle to left atrium. Semilunar valves prevent the backward flow of blood from pulmonary aorta and left systemic aorta to right and left ventricles. Entire heart is made of cardiac muscles. The walls of ventricles are much thicker than the atria. A specialized cardiac musculature called nodal tissue is also distributed in the heart. A patch of this tissue is present in the right upper corner of the right atrium called sinoatrial node. Another mass of nodal tissue is seen in the lower left corner of the right atrium, close to the atrioventricular septum. Close to the atrioventricular septum, called the atrioventricular node. A bundle of nodal fibers, atrioventricular bundle Atrioventricular bundle continues from the AVN, atrioventricular node, which passes through the atrioventricular septum, passes through the atrioventricular septa to emerge on the top of the interventricular septum and immediately divides into right and left bundles called bundle of His. The dash branches gave rise to minute fibers. Bundle of His gives rise to minute branches. We call them as Purkinje fibers. SAN, sinoatrial node. AVN, atrioventricular node. VOH, bundle of His. The nodal musculature has the ability to generate action potential without any external stimuli. Hence, it is called auto-excitable. Hence, it is said to be auto-excitable. The number of action potential that could be generated in a minute vary at different parts of the nodal system. Nodal tissue which can generate the action potential is nodal tissue which can generate the action potential is sinoatrial node. The sinoatrial node can generate the maximum number of action potential. That means that is about 70 to 75 per minute. 70 to 75 per minute. And is responsible for initiating the maintaining the rhythmic contractile activity of the heart. Nodal tissue which can be considered as pacemaker, sinoatrial node. Nodal tissue which can be considered as pacemaker, sinoatrial node. Our heart normally beats 70 to 75 times in a minute. The average beats is going to be 72. Complete the sequence. Sinoatrial node, 2. Atrioventricular node, 2. Bundle of His, 2. Purkinje fibers. Purkinje fibers. Action potential within the cardiac muscle fiber effectively transmit through these intercellular junctions. Intercalated discs. If all the four chambers of the heart are in a relaxed state, all the four chambers of the heart in a relaxed state, it is called joint diastole. Joint diastole. As the tricuspid and bicuspid valves are open, blood from the tricuspid and bicuspid valves are open, blood from the pulmonary veins, and vena cava. Blood from the pulmonary veins and vena cava flows into the left and right atrium, respectively. Left and right atrium respectively. As the tricuspid and bicuspid valves are open, blood from the pulmonary vein and vena cava flows into the left and right atrium respectively through the right and left atria. The semilunar valves are closed at this time. Semilunar valves are closed at this stage. The sinoatrial node now generate the action potential which stimulate both the atria to undergo a simultaneous contraction. We call it as atrial systole. This increases the flow of blood into the ventricles by about 30%. Atrial systole. The action potential is conducted to the ventricular side. Action potential conducted to the ventricular side by AVN, atrioventricular node, and AV bundle. Then AV bundle and bundle of His transmit it through the entire ventricular musculature. This causes the ventricular muscles to contract the atria. The atria undergoes contract and the atria undergoes relaxation coinciding with ventricular systole. The action potential conducted to the ventricular side by atrioventricular node and AV bundle, from where the bundle of His transmits it through the entire ventricular musculature. This causes the ventricular muscles to contract and the atria undergoes relaxation coinciding with the ventricular systole. Ventricular systole increases the ventricular pressure, causing the closure of tricuspid valve and bicuspid valve, due to attempted flow. Which flow? Backflow. As the ventricular pressure increases further, the semilunar valves guarding the pulmonary artery, open side, and the aorta as the ventricular pressure increases further, the semilunar valves guarding the pulmonary artery on right side and the aorta on left side are forced to open, allowing the blood in the ventricles to flow through these vessels into the circulatory pathways. The ventricles now relax and the ventricular pressure falls, causing the closure of semilunar valve, which prevents the backflow of blood into the ventricles. As the ventricular pressure declines, further the tricuspid valve, as the ventricular pressure declines further, the tricuspid and bicuspid valves are pushed open by the pressure in the atria exerted by the blood which was being emptied into them by the veins, and this is called passive filling. Ventricles and atria are now again in a relaxed state. As earlier, the blood now once again moves freely to the ventricles, and this process is called passive filling. Soon the dash generates a new action potential. Soon sinoatrial node generates a new action potential, and events described above are repeated in that sequence, and the process continues. The sequential event in the heart, which is cyclically repeated, is called cardiac cycle and consists of systole and diastole of both atria and ventricles. Human heart is called myogenic. Why? It has the ability to generate action potentials required with the help of sinoatrial node, which is a modified cardiac muscle. It is generating action potential. Pacemaker of the human heart is sinoatrial node. Relay point of human heart. Relay point of human heart we call atrioventricular node is called relay part. Number of action potential which SAM, sinoatrial node, can generate 100 beats it can generate. The minimum time gap required for the sinoatrial node to generate new action potential to the previous, that is about 0.6 seconds. Average number of action potential generated by sinoatrial node in normal healthy human is about 70 to 75. Number of action potentials generated by sinoatrial node per minute is equal to sinoatrial node per minute is equal to number of beats per minute. Do a muscle can generate action potential without any external stimuli? If yes, give an example. Yes. That is modified cardiomyocyte called SAN, sinoatrial node. Role of autonomous and normal coordination system for the regulation of heartbeat. They take charge increasing or decreasing the rate from normal state depending on the situation. Role of autonomous and hormonal coordination system for the regulation of heartbeat. Role of autonomous and normal coordination system for the initiation of heartbeat. For the initiation of heartbeat, there is no role at all. For the initiation of heartbeat, no role at all. We have to write it as no role. Coordination, role of autonomous and normal coordination system, asking here for the initiation of heartbeat. For the initiation of heartbeat, no role. Role of autonomous and hormonal coordination system for regulation of the heartbeat, now we can say they take charge increasing or decreasing the rate from normal state depending on the situation. Then a relay point that relays the action potential received from SEA node to the ventricular musculature is atrioventricular node. Atrioventricular node. Excuse me. Transfer of electric stimulus from one cardiac muscle fiber to the other is possible by gap junctions, or we call them as intercalated discs. Don't be confused with intervertebral discs. These are intercalated discs. Arch arises from the left anterior angle of the right ventricle, pulmonary arch. Arch arises from the left and transport the oxygenated blood to different parts of the body through its branches is systemic arch. Opening of the pulmonary arch into the right ventricle is guarded by a valve called. Opening of pulmonary arch into the right ventricle is guarded by a valve called pulmonary valve. Opening of the systemic arch into the right ventricle is guarded by a valve called. Opening of systemic arch into the left ventricle is guarded by a valve called we write it as aortic valve, and pulmonary and aortic valves are made up of, we call them as semilunar flaps. Both pulmonary and aortic valves. There are about three semilunar valves or flaps are there. We call them as pulmonary valve and aortic valve. A fibrous strand which is present at the point of contact. A fibrous strand which is present at the point of contact of the systemic and pulmonary arch is ligamentum arteriosum. Ligamentum arteriosum, non-NCERT, just for information. Connection between the pulmonary and systemic arches in lower vertebrates is called ductus arteriosus. Contraction of atria is called atrial systole. Contraction of ventricles is called ventricular systole. Relaxation of atria is called atrial diastole. Relaxation of ventricles is called ventricular diastole. Systole means contraction. Systole means contraction. Diastole means relaxation. Events of the conduction of electrical impulses which is required by the atrial systole is SA node, to the intercalated disc, transmitted to all the cardiac muscles by intercalated discs. Events of conduction of electrical stimulus which is required for the ventricular systole. We should start from SA node, then AV node, atrioventricular node, then from there it will pass into bundle of Hayes. Next, it will go to the Purkinje fibers. Then it will spread to all the cardiac musculature of the ventricle with the help of intercalated muscle level, that we have to take the support of intercalated disc. SC node to the AV node to the bundle of His to the Purkinje fiber to the intercalated disc. The cardiac events that occur from the beginning of one heartbeat to the beginning of the next constitute cardiac cycle. We call it as cardiac cycle. If all the four chambers of the heart are in a relaxed state, it is called joint diastole. The stage called joint diastole stage. Blood from the vena cava flows into right atria. Blood from the pulmonary vein flows into, here it is, right atria, flows into, from the pulmonary vein flows into left atria. Vena cava collects the deoxygenated blood from body parts. Pulmonary vein collect oxygenated blood from lungs. The three phases of cardiac cycle are, atrial systole and ventricular systole, then joint diastole. Events and actions occur in the different areas of the heart during joint diastole stage. Here, we need to take a look on the whole heart at one event time. Event is, now the event is joint diastole. During joint diastole, what right atria are doing? Right atria are receiving deoxygenated blood from vena cava. Right atria is doing what? Receive deoxygenated blood from vena cava. What left atria is doing? Left atria receive oxygenated blood from lungs. Okay, so next, what about right atrioventricular aperture? Right atrioventricular aperture. Wait a minute, receive deoxygenated blood from vena cava, receive oxygenated blood from lungs, left atria receiving oxygenated blood from lung. What right atrioventricular aperture is doing? Open, it pumps blood to the ventricles. It pumps blood to the passive filling, we can see. Blood to right ventricle. Asked about right ventricular aperture. So that's why we are answering here. And the same time, we are continuing the question here. Here it is event and action occur in different areas of the heart during joint diastole stage. What left atrioventricular aperture is doing? Open. So then and pumps blood to left ventricle. We call this as passive filling. Okay, passive filling. Next, what about tricuspid and bicuspid valve? Open. Tricuspid and bicuspid valve at this time, they are open. What about semilunar valve? Semilunar valves are closed at this time. So events to be that eagerly, that means individually, you have to think about in this area. Constant focus is required over to understand, to answer these kind of questions here. These are all applications. Events and action occur in the different areas of the heart during atrial systole. Systole. What right atria is doing during atrial systole? Right atria contracts and pumps the deoxygenated blood. Notice earlier also right atria is pumping the blood in diastole, that is passive filling. And now it is 30% active filling, contracts and pumps the deoxygenated blood to right ventricle. Next, what left atria is doing? Contracts. Left left atria is doing? Contracts and pumps oxygenated blood to left ventricle. This is active filling. This is about 30%. Then earlier one is passive filling. So that means to be noticed that not only during systole, also during diastole, there is a pumping of blood. Okay, events and action occur on different areas of the heart during atrial systole. Atrial systole, we are continuing here. We wrote right atria situation, left atria, and now we are moving on. Right ventricle, the same time at the time of atrial systole, what right atrial is doing, right ventricle is doing, it receives, as we said earlier, right atria is pumping, what it will do? Receive blood from right atria, receive blood from right atria. We call it as active filling. By the contraction it is happening. Left ventricle, receive blood from left atria. Okay. Then what tricuspid and bicuspid valves are doing this time? We need to say valves is open or closed. So they are open now even. They are open. Why? They are open. Blood should come from atria to ventricles. Next. So another question. Atrioventricular aperture. Nothing but the same. So then we have to say they are also open, and aortic valves, semilunar valves. We are talking about aortic valve and pulmonary valve. Semilunar valves are closed at this time. Events and actions occur in different areas of the heart during ventricular systole. Ventricular systole. So what atria is during ventricular systole? Atria in relaxed status. Atria are in relaxed status. They are in diastole condition, we can see. And atria on relaxed state. And what they are doing, blood from vena cava and pulmonary vein. Receive blood. At this time also, they are receiving blood. Blood from vena cava and pulmonary vein. They are receiving blood from vena cava and pulmonary vein. And next, what right ventricle is doing? Right ventricle, as ventricular systole, we said, it contracts and pumps deoxygenated blood. It pumps deoxygenated blood to lungs with the help of pulmonary aorta. With the help of pulmonary aorta. Doing what? With the help of pulmonary aorta, it is pumping the blood to lungs. Events and actions occur in different areas of the heart during ventricular systole. As we are continuing, as left ventricle, what left ventricle is doing? Left ventricle contracts and pumps oxygenated blood. Left ventricle contracts and pump oxygenated blood to body parts through left systemic aorta. Left systemic aorta, it is pumping blood to the body parts. Next, what about atrioventricular aperture at this time? They need to be during ventricular systole, atrioventricular apertures need to be closed. By creating the sound called lub, they need to be closed over. Events and actions occur in the different areas of the heart during ventricular systole. We are continuing here, tricuspid valve and bicuspid valve. As we said, the same atrioventricular aperture. They should be closed over, as we said now. What we call tricuspid and bicuspid valve close the atrioventricular aperture by creating sound. Called at this time, when they are closed, the sound will be created called lub. Creating sound called lub. Next, what about aortic and valve and pulmonary valve? So during ventricular systole, they should be open, isn't it? Because blood we are pumping there. Aortic valve and pulmonary valve. So next, events and action occur at the different areas of the heart during ventricular diastole. During ventricular diastole, right atria also in relaxed state. It is also in relaxed state and continues, as we said earlier, during systole also it is receiving blood, continues receiving blood from body parts, continues receiving blood from body part through vena cava, Okay, then tricuspid and bicuspid valves, they are open at this time, they are open. And what about left atria? Left atria, what it is doing during the joint diastole? The left atria is also in relaxed state. Left atria is also in relaxed state and continue receiving blood from lungs through pulmonary vein, And what about atrioventricular apertures at this time? They are open and they are helpful for passive filling. Nearly 70% blood and the ventricles are going to be filled at this time only. Events and action occur in the different areas of the heart during ventricular diastole. We are continuing here as we are seeing left atria and atrioventricular aperture earlier. Now continuing right ventricle, left ventricle. What they're doing at this time? Right ventricle and left ventricle, they are in relaxed state, isn't it? They are in relaxed state and receiving blood from in relaxed state, we can say relaxed state and receive blood from right atria and left atria. We call this as passive filling. Right atria and left atria. We say it as passive filling. Passive filling. Then semilunar flaps, they should close, otherwise blood will come back. So closed, creating a sound called dup. Sound said to be dup. Semilunar valves are closed by creating the sound called dup. Action potential generated in SAN initially promotes contraction of atria. Initially, they promote contraction of atria. When action potential reaches from SAN to AVN and followed to bundle of His and Purkinje fiber, it promotes contraction of ventricles. Time taken for each heartbeat is 0.8 seconds. 0.8 seconds. Time taken for atrial systole, 0.1 second. Time taken for ventricular systole, 0.3 seconds. Time taken for ventricular diastole, 0.5 4 seconds. Time period which atria in relaxed state during heartbeat, 0.7 seconds. Amount of time which atria pumps the blood into ventricles actively in each heartbeat, 0.1 second. Amount of time which atria pumps the blood into ventricle passively in each heartbeat is, in each heartbeat, how much time? That approximate, we can say 0.4 seconds, passive filling. The volume of the blood pumped out by each ventricle for each heartbeat is known as stroke volume, is known as stroke volume. The volume of blood pumped out by the heart from each ventricle per minute is termed as, per minute we can say it as cardiac output. First heart sound during heartbeat is known as love. Second heart sound during heartbeat is known as dub. Love sound is created during ventricular systole, during ventricular systole. Dub sound is created during ventricular diastole. Gap between the love and dub in compared with the gap between the dub to love of next beat is more or less, it is less. Love sound is created by the closure of tricuspid and bicuspid valves. Tricuspid and bicuspid valves close and create the sound love. Then dub sound is created by the closure of semilunar flaps. Semilunar aortic valve and pulmonary valve we can say. Mistake answer came. Closure of tricuspid and bicuspid valve can prevent the backward flow of the blood from and to. Tricuspid and bicuspid valve prevent the backward flow. Love sound it will come and they prevent backward flow from ventricle to atria. Semilunar flaps. Closure of semilunar valve prevent backward and flow of blood. Dub sound it will come and they prevent aorta and from pulmonary arch and left systemic aorta. Pulmonary arch and left systemic aorta to right ventricle and left ventricle respectively. In detail note, we can say like this, respectively. This increases the flow of blood into the 8 ventricles by about 30%. We talk about atrial systole. Just we discussed about that. Who increases atrial systole? It increases the pressure causing the closure of AV valves. Atrioventricular valves, pressure on atrioventricular valve, that is done by ventricular systole. When it increases further, the semilunar valves guarding the pulmonary artery and aorta are forced to open. We are talking about ventricular systole. This allows the blood into the ventricles to flow into the aortic arches and enter the circulatory pathway. Ventricular systole. Amount and percentage of blood enter into ventricle during atrial systole. In stroke volume, in case stroke volume is 70 ml, it will be 21 ml we are going for. That means that is about 30% we can say. Amount and percentage of the blood enters in the ventricle during atrioventricular diastole. It is nearly about 49 ml passive filling we can call. Then percentage wise we can say we can answer it as 70%. 70%. Now, during ventricular diastole, as during ventricular diastole, as the ventricular pressure decline, further the AV valves are pushed open by the pressure in the atria exerted by the blood. The blood now once again flows freely into the ventricles. Then questions are here. Such method of filling ventricles is called. Such method is called Passive filling, it is about 49 ml of blood is going to be filled like this. 49 ml of blood. Okay. Next, amount of blood reaches to ventricles in this process. What do you call the process as? Process said to be passive filling. Amount of blood they are asking. Okay, amount of blood we write 49 ml. Then this blood pumped out during what time it will pump down? Passive filling will be done on joint diastole, during joint diastole, and will be used for next heartbeat. This blood will be used for next heartbeat. Amount of blood in ventricles, especially left ventricle after ventricular systole, is called end systolic volume. End systolic volume. Amount of blood in ventricle, especially left ventricle after ventricular diastole, is called end diastolic volume. Next, amount of blood which always remain in the ventricle, amount of blood which always remain in the ventricles is called residual volume. Residual volume. Answering all these questions, we are going to learn a great concept here. Blood is not only filled during systole, also during diastole. Considerable amount of the blood is coming to the ventricle from the atria. 135, write the volumes of the blood in ventricles. We are talking about uh, during especially left ventricle at the end of systole. How much blood can be seen over? 120 ml. 120 ml. At the end of systole, in the ventricle, blood is about 120 ml. Next, at the end of ventricular systole, after losing 70s in the stroke volume, how much will remain? 50 ml only. That is called residual volume. And at the end of atrioventricular at the end of atrioventricular diastole, here we need to ask this question here as diastole. Wait a minute. At the end of atrioventricular diastole, we'll find the blood nearly 99 ml, because in passive filling 49 ml is going to be added over. That's why 99 ml will find. Now, at the end of atrial systole, the volume of blood in ventricle is 120 ml, 50 ml, 49 ml, 21 ml. We need to answer what all these are. Here, wait a minute, just we are moving on. A, 120 ml. What is 120 ml? That we need to answer. What is 120 ml? 120 ml. Blood in the ventricles after atrial systole. Blood in the ventricles after atrial systole. Okay. Next, what about 50 ml? 50 ml, we said already that is residual volume. Okay. And what about C, 49 ml? 49 ml, we answered earlier, blood filled in joint diastole of previous heartbeat. Joint diastole of previous heartbeat. Okay, then we refer D, whom we are talking about 21 ml. That is blood filled in ventricles in current atrial blood filled in ventricle during current atrial systole. We can see. This is the answer. At the end of one heartbeat, before the beginning of another heartbeat, amount of blood in ventricles. Amount of blood in ventricle is 99 ml. If number of heartbeats are 75 per minute, time taken for each heartbeat is 60 seconds. Let us do the problem here. Then 60 seconds, 75 beats. So that we have to write like that, 60 by 75 beats, we get the answer here 0.8 seconds. So if number of heartbeats are 75 per minute, each heartbeat takes about 0.8 seconds. If each heartbeat takes time about 0.8 seconds, Find out the number of heartbeats per minute. How we do calculate? One heartbeat is taking 0.8 seconds. In the 60 seconds, we have to do it like 60 by 0.8, then we'll get 75 heartbeats. Same problem, that we just made a small change. If stroke volume is 70 ml, number of heartbeats per minute are 72. Find out the cardiac output. Stroke volume into, what we do here, stroke volume into 70 ml is the stroke volume into number of heartbeats per minute, 72 beats. So 70 into 72, we get 5040 ml. If stroke volume 70 ml, number of heartbeats per minute are 75. What is the principal? Cardiac output equal to the stroke volume into number of heartbeats per minute. 75 beats is given. So 5250 ml. If it is 75. If stroke volume is 70 ml and each heartbeat takes time about 0.8 seconds, here actually we need to do the problem, but already we are seeing if 0.8 seconds are there, the cardiac number of heartbeats per minute will be 75. So from the above problem, I am doing directly here 70 ml into 75 beats. If 0.8 second, one heartbeat is taken, it is about 75 beats it will come, and the cardiac output will be 5250 ml. Moving on, if the stroke volume is 70 ml and each heartbeat takes 0.6 second, if one heartbeat takes 0.6 second, that means in 60 seconds there is 100 beats possible. So that's why we can say that 7000 ml. Factors which can increase and decrease the cardiac output are: stroke volume can be increased over, stroke volume can be altered, factor it can be altered, and number of heartbeats also can be altered. Number of heartbeats and stroke volume both can be altered here. The blood pumped by the right ventricle enters into this artery. Blood pumped by the right ventricle enters into this artery. From the right ventricle, it will come to the pulmonary artery, pulmonary aorta, bigger vessel called aorta. Blood pumped to the left ventricle enters into left systemic aorta, arch, whatever, bigger vessels called aorta. Oxygenated blood pumped into the pulmonary arch is passed into left atria. We have to answer it as passed into oxygenated blood pumped into the pulmonary arch, passed into, wait a minute, we have a small oxygenated, Nani, we have to say deoxygenated blood pumped into the pulmonary arch, passed into, we should answer lungs. We started from right ventricle because arch means artery. Oxygenated blood which is carried by the pulmonary vein enters into left atria. Pumping of deoxygenated blood into lungs and collecting oxygenated blood from lungs is called pulmonary circulation. It is said to be pulmonary circulation. Right? We are getting here answer. Yeah. Circulation, we call it as pulmonary circulation. The oxygenated blood entering aorta is carried by network of arteries, arterioles, and capillaries and carriers towards body parts. Deoxygenated blood is collected by a system of venules, veins, and vena cava are emptied here. All are emptied at right atrium. Supplying oxygenated blood to the body parts and collecting blood from the body parts is called systemic circulation. We call such kind of circulation as systemic circulation. Circulation of the blood related to and from the body parts is called systemic circulation. Circulation of blood related to and from the lungs is called pulmonary circulation. Circulation which provides nutrients, oxygen and other essential substances to tissues is called systemic circulation. Circulation which collects carbon dioxide and other harmful substances for their elimination is called pulmonary circulation. Lesser circulation and greater circulation respectively. Pulmonary circulation is lesser circulation. Systemic circulation has to long way, hence it is called greater circulation. Chambers of the heart which are related to systemic circulation directly. Directly, chambers of the heart which are from left ventricle to right atria. The movement of circulation from left ventricle to right atria only called as systemic circulation. Left ventricle supplies the blood to body parts with the help of left systemic aorta. Right atria collects the blood from the body parts with the help of superior and inferior vena cava. Body part receive blood from the heart with the help of receive blood from the heart with the help of left ventricle. Pumps the blood to through left systemic aorta. Blood vessels which supplies blood to body parts, which we are talking about, left systemic aorta. Chambers of the heart which are related to pulmonary circulation directly. Pulmonary circulation. Actually, it starts from right ventricle and goes to the right ventricle, pulmonary aorta, lungs, pulmonary vein, we reach to left atria. Chamber of the heart which pumps the deoxygenated blood to lungs. As we now said, right ventricle. Chamber of the heart which collects blood, oxygenated blood from lungs. Left atria is collecting blood from lungs. Blood vessel which pumps the deoxygenated blood to lungs from the heart. Pulmonary aorta. Pulmonary aorta. Blood vessel which collects the oxygenated blood from lungs. Pulmonary vein. Write the path of blood from left ventricle to right atria. Left ventricle first, then after left systemic aorta, we say left systemic aorta, which goes to the body parts, then reaching to the body parts. From there, we need to come for the body parts. Vena cava are going to collect the blood, vena cava, and from the vena cava, it reaches to the right atria. Then write the path of blood from right ventricle. Let's start from right ventricle, writing in abbreviated form, right ventricle, pulmonary aorta, and then reaches to the lungs. From there, you have to get back pulmonary vein, then left atria. We come to the left atria. Circulation of the blood from left ventricle to right atria is called systemic circulation. We call it as systemic circulation because it related to the body parts. Right ventricle to left atria called as pulmonary circulation because it related to the lungs. A blood vessel that starts in capillaries ends in capillaries. A blood vessel that starts in capillary ends in capillary. Portal vessel. We say it as portal vessel. And if in man, there is a portal system between the digestive tract and liver. It is called hepatic portal system. We say it as hepatic portal system. Blood vessel which carries the blood from gut to the liver. Hepatic portal vein. We say it as hepatic portal vein. Blood vessel which carries the blood from liver to the inferior vena cava. Liver to the inferior vena cava. Hepatic vein. A system of portal vessel named on this basis after the name of the organ in which it ends. In which it ends. That is, in liver we said it as hepatic portal system. In kidney, if it is renal portal system, we can see. Advantage of hepatic portal system in human: excess sugars, what we eat, that immediately reaches to the liver and converts in as glycogen. It converts as glycogen in liver with the help of a hormone released from the pancreas, that is insulin. Hepatic portal vein begins at gut. Hepatic portal vein ends at liver. Hepatic vein collect blood from liver. Hepatic vein opens into vena cava, inferior vena cava. Particularly, we have to answer it as inferior vena cava, post caval vein, even we can call it. Hepatic portal vein is present between hepatic portal vein is present between gut and liver. Hepatic vein is present between vena cava and liver. Then a special system of blood vessels of human body which are exclusively for the circulation of the blood to and from the heart is coronary system. We can say it as coronary system. Amount of sugars comparatively more in this vein, that they are coming from the gut, which is the hepatic portal vein. Who is coming from the gut? They have definitely arteries which participate in coronary circulation. Arteries participate in coronary circulation, right and left coronary arteries, right and left coronary arteries. Amount of urea is more in, as liver is preparing synthesis of urea, hence we'll find hepatic vein. The path is from the liver through hepatic vein, it goes to the inferior vena cava to reach into the kidney. 188 veins which participate in coronary circulation are cardiac veins. Veins are cardiac veins, or we can call them as coronary veins. Cardiac veins are coronary veins. Then the body has the ability to alter stroke volume. The body has the ability to alter stroke volume, heart rate, stroke volume, as well as the heart rate and thereby the cardiac output. For example, the cardiac output of an athlete, it is possible, will be much higher than that of an ordinary man. Number of coronary arteries, coronary veins in human. Number of coronary arteries and coronary veins, 2 and 4. Coronary veins opens into, all the coronary veins opens into coronary sinus, opens into a bigger vessel, coronary sinus. Coronary arteries arises from left ventricle, particularly left systemic aorta. It gets innominate artery, but no matter. Coronary arteries arises from left ventricle. We follow NCERT. Straight answer. Coronary arteries arises from left ventricle. What they carry? What they carry? Oxygenated blood they carry. Coronary arteries goes to cardiac muscle. Cardiac musculature requires oxygenated blood for contraction. So that's why they go to the cardiac musculature. Coronary veins arise at, that means it's a circulation related to the heart muscles. So arise at cardiac muscles, we can see. Artery supplies, veins collects from there. Coronary sinus opens at right atria. Exactly, we have to say it as at the left precaval vein, which valve is guarding them, valve of Thebesius. No matter, NCERT is not given all of them. Coronary sinus opens at right atria, we said. Opening of coronary sinus is guarded by a valve, valve of Thebesius, not NCERT, not there in NCERT. Just for information, valve of Thebesius. Normal activities of the heart are regulated intrinsically by nodal tissue. Intrinsically by nodal tissue. Normal activities of the heart are called auto-regulated. Why? Because it's done by specialized cardiac musculature of heart. Done by specialized cardiac musculature of heart. A special nodal center of the brain to present here to moderate the cardiac function through autonomous nervous system, that is medulla oblongata, part of ANS which send neural signals to increase the heartbeat, strength of ventricular contraction, thereby cardiac output. We call sympathetic nervous system can do this. And controlling which decrease the heartbeat, parasympathetic nervous system, antagonistic invert. Sympathetic rises, parasympathetic decreases. Hormones of adrenal medulla which can increase the cardiac output. Epinephrine, we call it as adrenaline also. Epinephrine or adrenaline and norepinephrine or noradrenaline. Noradrenaline. Hormone of thyroid gland which can increase the cardiac output. Thyroid gland hormone which can increase the cardiac output is thyroxine, which is maintaining basic metabolic rate, hence it involved. Blood leaving the heart passes through the vessel progressively smaller diameter. They are arteries, then arterioles. First we have to come through aorta, then artery, arteriole. Then finally they get capillaries, they say capillary. Microscopic vessel that join the arterial flow and the venous flow are called as capillaries. Blood returning to the heart from the capillaries passes through the vessels of large diameter and they are called venules first, and all the venules form veins and veins form vena cava. Number of layers in the wall of arteries and veins, 3. Then tunica externa is also called tunica adventitia. Tunica externa of arteries is made with fibrous connective tissue which contain collagen fibers. Veins are also the same. Additionally, in arteries, you will find elastin fiber which gives elasticity to the arteries, but both are having fibrous connective tissue. Tunica media of both arteries and veins are made up of smooth muscles. In case of arteries, they are thick. In veins, they are thin. Endothelial layer with basement membrane in arterial and ventricular walls. Tunica interna. In both arteries and veins, we can use this word, tunica interna. Blood vessels whose endothelium is double folded to form walls. That is veins. In veins, it is possible. They are directed toward the heart and they allow flow of blood toward the heart only. Walls. They are present in the veins, walls. Okay. Identify the blood vessel as artery or vein based on the characteristics given below. The two elastic laminae on either side of the muscle layer, artery. One elastic laminae inner to the muscle layer, vein. Then thin muscle layer in the tunica media. Thin muscle layer, we say vein. Thick muscle layer, we call artery. Arteries are having muscle layer thick. Identify the blood vessel as artery or vein based on the characteristics given below. Carry oxygenated blood. Arteries and pulmonary vein. Then carry deoxygenated blood. Veins and pulmonary artery. Blood away from the heart. Arteries. Arteries are taking blood away from the heart. Then veins brings the blood towards the heart. Identify the blood vessel or as artery or vein based on the characteristic given below. Pumping the blood from heart. Pumping the blood from heart. The same again, we have to say that arteries are pumping, no exception at all. All arteries are in pumping only. Wait a minute. And moving the blood into the heart, veins, we can see. Bright red colored blood. Oxygenated blood is bright red color. So all arteries, we can say, and the pulmonary artery is also carrying oxygenated blood. Hence, we can say arteries are carrying bright red color, dark red color, veins, and pulmonary artery, which is carrying deoxygenated blood. Mostly deeply seated vessels in the body. Deeply seated are arteries, and peripheral or superficial are going to be veins. Thick-walled blood vessels with thick tunica media, that is artery. Thin-walled and relatively thin tunica media, vein. Wide lumen, vein. Narrow lumen, artery. Non-valvular blood vessels, all arteries except pulmonary and systemic aorta. Pulmonary aorta and systemic aorta. They are having semi-linear walls. Valvular blood vessels. All veins except vena cava. All veins except vena cava. Blood flow with more pressure and jerks. That is possible in arteries. Next, blood flow is steady and low is in veins. End in capillaries, artery. All arteries end in capillary tissue. Start with capillaries, vein. Start with capillary, vein. Next, smallest vessel present in the walls of large blood vessels like aortic arches are called. This is completely non-NCERT, just for information only. This we are talking about a blood vessel present in the walls of larger blood vessel like aortic arches are called as, we are talking about vasorum, which is supplying blood to the blood vessels itself. We can ask it, we can like this, the blood capillary which supplies to the blood vessels. Smallest blood vessels of the body which connect arterioles and venules, we called already capillaries. Smallest blood vessel which contain only endothelium, capillaries. Endothelium of blood vessel is composed with simple squamous epithelium, which is very thin, helpful for the filtration of excretory wastes and gaseous exchange. Absence of these in the capillaries permits more rapid exchange of material between the blood and tissues. Smooth muscles and connective tissue layer. Smooth muscles and connective tissue layer. Then you are probably familiar with this scene from a typical hospital television show. A patient is hooked up to a monitoring machine that shows voltage traces on a screen and make sound beep beep beep. As the patient goes into, we are talking about cardiac arrest, and this type of machine is called ECG, electrocardiogram or electrocardiogram. The machine electrocardiogram is used to obtain electrocardiogram, a graphical representation of the electrical activity of the heart during cardiac cycle is called electrocardiograph. To obtain a standard ECG, patient is connected to the machine with three, according to NCERT, that three connected to the three electrical leads, one to each wrist and to the left ankle. For a detailed evaluation of the heart's function, that they sometimes the leads may be multiple on chest also. In a standard ECG, each peak in the ECG is identified with a letter from P, T, and electrical activity of the heart. Wave which represents the electrical excitation of atria is called P wave. Wave complex which represents the electrical excitation of ventricles, QRS complex. Wave which represents the depolarization of atria, P wave. Wave complex which represents the depolarization of ventricle, QRS complex. Wave which represents the ventricular repolarization, P wave. Wave which represents the contraction of both atria, P wave. Wave which represents the contraction of both ventricles, QRS complex. QRS complex. The end of the T wave marks the end of the T wave marks the end of systole. Physiological activity of the heart during P wave. Blood pumped from atria to ventricles. Blood pumped from atria to ventricles. Physiological activities of the heart during QRS complex. Blood pumped from ventricles to lungs and body parts. Next, when electrical impulses begin at sinoatrial node, it is recorded this wave, P wave. The dash represent return of the ventricles from excited to normal state, T wave. QRS complex represents the depolarization. QRS complex represents the depolarization of ventricles which initiate the ventricular systole. The contraction starts shortly after Q and marks the beginning of ventricular systole. Marks the beginning of ventricular systole. Since the ECGs obtained from different individuals have roughly the same shape for a given lead configuration, any deviation from the shape indicates a possible abnormality or disease, maybe myocardial ischemia or myocardial infarction, whatever like that. Obviously, by counting the number of QRS complexes, obviously, we count the number of QRS complexes that occur in a given time period, one can determine the heartbeat rate of an individual. Normal activities of the heart are regulated intrinsically, then auto-regulated by specialized muscle. Hence, our heart is called myogenic heart. A special neural center in the brain, particularly at medulla oblongata, can moderate the cardiac function through sympathetic, we call autonomous nervous system. With the help of autonomous nervous system, they can moderate neural signals through the sympathetic nerves, part of ANS, can increase the heartbeat, the strength of cardiac output also, the strength of ventricular strength, sympathetic and ventricular contraction, thereby cardiac output. Neural signal, parasympathetic neural signals. Parasympathetic neural signal component of ANS decrease the rate of heartbeat, speed of conduction of action potential, and thereby the cardiac output. Dash hormones, adrenal medullary hormones, epinephrine, norepinephrine, or adrenaline, noradrenaline, we can say. The term, the blood pressure, blood pressure that is higher than normal, we can say hypertension. The blood pressure is higher than the normal, we can say. Normal blood pressure in human is 120 by 80, systolic pressure by diastolic pressure. Systolic pressure, pumping pressure of human, systolic pumping pressure of human is 120, diastolic pumping pressure of human is 80. Blood pressure in human is measured in sphygmomanometer. Blood pressure in human is measured in sphygmomanometer in the form of a millimeter of mercury pressure, Hg. If repeated checks of blood pressure, an individual is 140 by 90 or higher, it shows, what do you call it? Shows hypertension. High blood pressure leads to, high blood pressure leads to various kinds of diseases, heart diseases, which may affect the organs like brain and kidney. Coronary artery disease, often referred to as atherosclerosis. Angina, often referred to as angina pectoris. Warning signal. Heart failure, sometimes often referred as congestive heart failure. State of heart when it is not pumping blood effectively enough to meet the needs of the body can be considered as heart failure. If heart stops beating, it is considered as cardiac arrest. When heart muscle suddenly damaged to inadequate blood supply, it is considered as heart attack. Disease which affects the vessel that supply blood to the heart muscles is coronary artery disease. Coronary artery disease. Congestion of the lungs is one of the main symptoms of this disease, heart failure. A symptom of acute chest pain appears when no enough oxygen is reaching the heart muscle. Identify the disease, angina pectoris. Angina pectoris. Disease which is caused by the deposits of fat, calcium, cholesterol, and fibrous tissue, which makes the lumen of coronary arteries narrower. That is coronary artery disease. Disease which can occur in men and women of any age but is more common among the middle-aged and elderly, and it occurs due to conditions that affect the blood flow. That is angina pectoris. Why the heart failure is considered as congestive heart failure? For sometimes congestion of the lungs is one of the main symptom of this disease. Main symptom of this disease. Congestion of lungs is the main symptom of this disease. Read the statement and answer correct or incorrect. Heart failure is not the same as cardiac arrest or heart attack. Correct. And thank you for patience.